Hello, everyone. Welcome to today's presentation on the important topic of milk as medicine, presented during Indigenous Milk Medicine Week, highlighting the vital role of donor human milk in infant care. This event is being co-sponsored by Family Services and the UC Milk Bank. I am Maria Heatherton, neonatal dietitian and supervisor for the inpatient pediatric dietitian team at UCSF. Joining me today is Natalie Larson, Director of Family Services, and Pauline Lee, Family Services Manager. Before we start, we would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship and mutual respect and understanding. Now, I am delighted to introduce our presenter, Allison Wolf. Allison is a pediatric nurse practitioner and internationally board-certified lactation consultant with 3 decades of experience in newborn medicine. Since 2023, Allison has served as the executive director of the University of California Health Milk Bank, where she has led transformative efforts to elevate standards in newborn nutrition and expand equitable access to donor human milk across California and beyond. This talk is being recorded, and the recording, as well as the slide presentation, will be emailed to all registrants and available for future viewing on our website. The chat function has been disabled, but you may enter your questions in the Q&A, and we will answer those at the end of the presentation. Thank you to those who submitted questions during your registration process, and these questions were submitted to Allison ahead of time. There is an opportunity to earn 1 CE credit through the San Diego Health, and Allison will explain this process further. Now, we will start with the presentation by Allison. Thank you.
Maria, for that kind introduction, and thank you all for joining us today. First, I just want to say, in recognition of Indigenous Milk Medicine Week, I want to begin by acknowledging that I am not Native or Indigenous. I am honored to learn from and lift up the work of Indigenous leaders who have stewarded milk as medicine for generations. Today's my role is not to speak for Indigenous communities, but to align our donor milk work with the values that they so clearly articulate. As I was doing a little bit of research for this presentation, I was really impacted by learning more about Indigenous milk medicine and what that means and what that community means. And it really aligns with a lot of the things what we are doing here at the UC Health Milk Bank. A little bit more about myself. I graduated UCLA. I am a diehard University of California alumni. Graduated from UCLA with my nursing degree and worked in the NICU and pediatric transport. I then got my pediatric nurse practitioner degree and started at UCSD in newborn medicine, and then more recently transitioned over to the UC Health Milk Bank as the executive director. So it's been a really fun journey, taking care of mamas and babies and lactation, and finally integrating all that into how can we provide equitable access of donor milk for all of California. And the purpose, I really want to kind of bring up real quick, National Breastfeeding Month. This year's theme is Rise, with the themes of resilience, interdependence, self-determination, and empowerment. And the purpose of the month is really to mobilize individuals and organizations to come together for conversation about policy and practice changes that we need to do to really build a landscape of support for babies and families. So I appreciate being able to partner with UCSF to get this message out here. And really, again, how do we come together as a community to support these babies and families? And then more specifically, this week, we are celebrating Indigenous Milk Medicine Week with the theme of We Keep the Fires Lit, Rising Through Milk Medicine. And if most people are probably aware, the breastfeeding month is broken up into different weeks celebrating different communities. And really, these cultural observances demonstrate why efforts led by serving impacted communities is really vital for advancing equity and reducing disparities. We all have the opportunity to learn and take action to support a brighter future for everybody. And Indigenous Week was created to encourage and uplift the diversity of Native breastfeeding experience. And for Indigenous people, milk medicine is a sacred tradition. It goes beyond breastfeeding. It is an act of love and care that nourishes not only bodies, but spirits and community bonds. And this really, I think, is such a beautiful perspective of this. And I love this quote from Heather. It's from Indigenous Midwifery. Breastfeeding and chest feeding grows love. It helps babies grow. It helps communities grow. It helps people blossom when it's well supported. Again, this idea of how do we build this foundation? And getting in a bit into human milk and this idea of that human milk is this biological substance and it impacts every part of this growing baby and protects the tiniest, these tiniest bodies in the powerful way. And, so human milk is more than nutrition. Like I said, it's a living biological system. It contains immune factors, hormones, growth factors, beneficial bacteria, and multiple other bioactive components that really help shape an infant's developing gut, immune, metabolism, and brain. And uniquely, breast milk is produced by a specific mother for her specific baby in response to a specific environment. And it really changes based on that baby's needs and the environment. And through these interactions, human milk actively supports the growth, development, and lifelong health. And so, really thinking of how important this is, and doesn't every baby deserve access to this vital nutrition and medicine? Um, the American Academy of Pediatrics recently updated their very low birth weight guideline this year and reiterated that human milk as a base diet is the optimal nutrition source for very low birth weight infants, and that it does significantly decrease several different complications of prematurity, including neck or necrotizing enterocolitis that I'll get into a little bit more in the next slide. And when mother's own milk is not available or insufficient, donor milk is recommended. And so about 80% of NICU babies need additional milk outside mother's own milk at some point. And so that's really where donor milk fills that gap. And then it is reasonable if mother's own milk is not available, it is reasonable to transition from donor milk to preterm formula at a time when the risk of developing neck is low. So at about 34 to 36 weeks post-gestational age. The great thing about this guideline also is that it has a lot of information about how to support that mother in her own lactation journey. Because again, donor milk can fill those gaps, but it's mother's own milk that is superior to donor milk, and that will be what the baby's going home eating. A little bit about neck or necrotizing enterocolitis. This picture, actually, Stephanie, who is joining on this webinar. This is a picture of her baby Izzy, who is going to her senior year of college and doing amazing. But so neck is a sudden bowel catastrophe that affects up to about 12% of very low birth weight infants. So the smaller the baby, the more premature baby, the more they are at risk. And it usually happens once the baby's actually starting to, do a little bit better, get stabilizing, starting feeds. And then it's devastating. And the worst cases have about 100% mortality rate, with one baby a day dying of neck in the US each day. And the only modifiable risk factor is a human milk diet. And so we do know that human milk can reduce neck by about 90%. It's multifactorial. We don't know everything that's involved. We're not even quite sure, is it the presence of formula or the absence of human milk that causes the neck? But we do know that if by that human milk based diet, and the latest studies really do demonstrate that it's the base diet, the fortifier, whether that's bovine based or human milk based, doesn't seem to impact neck. It's that base diet. But one of the things we do know that's protective in human milk is HMOs, or human milk oligosaccharides. HMOs are complex sugars that are found almost exclusively in human milk, and is the third most abundant component in breast milk. And interestingly enough, the infants don't even digest the HMOs. They actually go to they feed the microbiome and play a critical role in protecting the developing intestines. And so the HMOs help prevent neck by promoting a healthy microbiome. They block harmful pathogens from attaching to the intestinal lining, and they help strengthen the intestinal barrier, helping to protect the immature gut from injury. And so we do know that one HMO in particular, DLSNT5, is associated, so higher levels of DLSNT are associated with lower risk of neck in preterm infants. And still really doing a lot of research to understand how this works. But that's really where that human milk, one part of the human milk that helps protect against neck. And then circling a little bit back to the equity piece, there was this study that came out that looked at very low birth weight infants cared for at about over 800 U.S. hospitals, and the human milk at discharge. And so if you're able, it's kind of hard to see on these slides, but there has been a steady increase in human milk at discharge, but there still is a disparity, specifically in Black and Native American populations have lower human milk at discharge. And when human milk is recognized as both a biological medicine and an indigenous first medicine, these disparities really do become an equity issue. So supporting equitable access to human milk, lactation services, donor milk really can help ensure that all infants receive the protective benefits of this true medicine. And then we also know, on top of that, these systemic inequities, they increase infant vulnerability by creating barriers to accessing human milk and lactation support. So structural racism, poverty, implicit bias, insufficient paid leave, food insecurity, historical trauma. For populations already experiencing health disparities, unequal access to human milk can further widen, these gaps in infant outcomes. And the persistent disparities of human milk provision among Native Americans and other marginalized communities really highlights how social and healthcare inequities can translate into increased biological risk for these vulnerable infants. So again, kind of circling back to the theme of Breastfeeding Month, this rise, and how do we build a community that helps support everybody? And just, benefits of donor milk in the hospital. There's a lot of benefits of donor milk use when mother's own milk is unavailable or insufficient, particularly for those preterm and very low birth weight infants. So we really need to do everything we can to ensure that all vulnerable infants have access to donor milk, regardless of race, ethnicity, geography, socioeconomic status, and really where they're born. Hospitals can help reduce disparities in outcomes and provide a bridge to the benefits of human milk during this really critical period of development. And I'm going to talk a little bit later in the presentation about a project, the 100% project that we worked on to really try to increase this equitable access. Real quick, I'm going to talk a little bit about nonprofit milk banking. So there are for-profit milk banks and nonprofit milk bankings. Nonprofit milk bankings are accredited through the Human Milk Banking Association of North America, or HABANA. There are 31 milk banks in North America. Um, so between Canada and the US, so there's not we're kind of a niche field. Um, we are registered with the CDPH for our tissue bank license, and then also with the FDA for our food registration. We also have to follow local regulatory steps. One of the big things are that donors are never paid for their milk. And although I 100% understand how hard these families are working to pump and label and freeze and blood test and shipping, that once you kind of start payment for it, it just opens up an ethical can of worms. You know, potentially, are they not feeding their baby to sell their milk? Are they adding things to the milk? Those type of things. And then the milk is always heat pasteurized and tested. So a lot of safety standards to make sure that the milk that are going to these tiny vulnerable babies is completely safe. Um, and a little bit about the process. You can kind of see behind me, this is our milk lab. Um, and so I'm going to go into the screening process in a minute, but screening of the donors. But the milk lab and processing, is this meticulous process to make sure that we have um, the safest and highest nutritional quality product that we possibly can. Um, and so what we do is we pool together about 5 to 9 donors. We do this because there's a lot of different calorie and protein um, counts in breast milk in general. And so we want to make sure that every bottle has a consistent minimum calorie and protein count to really help these little babies grow. So we pull together those 5 to 9 donors. We do a pre-pasteurization bacillus screen. So bacillus is the one bacteria that is not eliminated during the pasteurization process. It's a normal environmental contaminant. So we don't want, if one donor has bacillus, we don't want to add it to that pool and contaminate the pool. We then thaw the milk, and when we get that pre-pasteurization culture back, we pool together those donors in a big pot, mix it so we can get homogenize it as much as possible. It is then put into bottles and capped, and then placed in pasteurizers. We do Holder heat pasteurization for 30 minutes. A bottle is then pulled from each batch and sent for a secondary bacterial culture to make sure that there's nothing harmful growing in the milk. And then once we get that back, it's actually a 2-person verification to make sure that the milk was heat processed for the right amount of time, and that those cultures came back negative before they can go out for distribution. Every single one of our donors gets a nutritional analysis, and every single pool gets a nutritional analysis. So we know exactly how many fat and calories and protein are in each bottle, and then that information is put onto the label that's on the bottle and into the barcode so that it can be scanned in. And then one of the questions I get a lot is, what happens during the pasteurization process? So I mentioned earlier that, human milk is made for that mama, for that baby in that environment. And that was one of the reasons why mother's own milk is superior. And then there are some things that do happen during the pasteurization process. The majority of the macro and micronutrients remain intact. The iron, vitamins, IgG, IgA, a lot of the hormones, human milk oligosaccharides, antibodies, all those type of things are intact, remain intact during the pasteurization process. What is eliminated is live cells, even beneficial live cells, bacteria, viruses, and lipase. And then you do have a decreased levels of IgM, lysosome, EPO, zinc, leptin, and vitamin C. So especially for babies that are on long-term donor milk use, they potentially might need some vitamin supplementation to make sure that some of those nutrients that might be lacking in the pasteurized milk. Habana, so Human Milk Banking Association of North America updates. This year, so 2025, record distribution of approximately 13 million ounces of pasteurized donor milk went out to babies in the US. Um, Donor milk is now available in more than 92% of level 3 NICUs in the country. California currently only has one level 3 that does not have donor milk, but they are already in contract with us and just working on implementation. So it's really exciting to be able to say that all those babies born into a level 3 NICU in California will have access. And again, I'll talk a little bit more about our 100% project. And what we're seeing a lot of too is a little expansion of donor milk into mother baby units. And the evidence is not as strong. I mean, obviously for VLBW, very low birth weight infants, there are very clear documented benefits of donor milk when mother's own milk is not available for neck prevention and other things. There's also growing literature for some of our other babies, potentially with congenital heart defects, GI defects, those type of things that there's benefits of donor milk. The full term healthy baby, there is not as much strong evidence that there's a significant difference. Although if a family is planning on exclusively breastfeeding, formula use does alter the microbiome. Long-term effects there aren't clearly documented. There was one study, the AAP recently came out, that showed that exclusive human milk in the first 3 days of life decreased the rates of eczema and asthma, kind of this idea of priming the gut and a lot of these hormones and beneficial factors that help prime the gut even with formula after that. So it'll be interesting to see kind of where that goes. At the UC Health Milk Bank, we have a prioritization guideline so that NICUs have the number one priority and always will be served, and other in-hospital ICUs, PICUs, and CV ICUs. Our second kind of tier are those couplet care, bridge milk. They're using very small volumes. The babies usually have a average length of stay of about 1.5 days and taking very tiny volumes in that time. Next tier would be our outpatient medical necessity families. And then the very last tier would be kind of young, healthy term babies. So again, being able to prioritize where that milk is going to make sure that the babies who truly need it will have it. And a little bit about a little bit more about the UC Health Milk Bank. We are fairly new. We were founded in 2020 and really with the idea of being able to pull on this large academic health system, the entire UC system, with these partnerships to be able to elevate really that standard in milk banking. We are a nonprofit Habana Milk Bank. We are owned and operated by UC San Diego Health. Although we were gifted the UC Health name, we were the first individual department to be gifted that big name. We are located inside the San Diego Blood Bank. We have a great relationship with them. There's a lot of parallels between milk banking and blood banking. Blood banking is much bigger. They're probably about 10 years ahead of milk banking. And so really a lot of knowledge sharing, learning from them. They have multiple depots throughout Southern California that our donors are able to drop off milk and get their blood tests. We also are able to service out-of-area donors. I'll get into that in a little bit, but really a great partnership that we're excited for it to continue to grow. We are also associated with the Human Milk Institute up on campus, so really this research innovation ideas. Is there a better way to pasteurize milk than Holder pasteurization? Yes. How can we look at doing that? What are different ways, maybe that we could keep some of those active cells alive while eliminating those harmful bacteria and viruses? Always there's, looking at better ways of doing this. Again, I talked about setting the standard in newborn nutrition and milk banking. And then the other thing we really pride ourselves on is, I talked about that we don't reimburse our milk donors, but how can we make this a meaningful experience to them? So we spend a lot of time, excellent customer service, education, letting these families know exactly where their milk is going, neck prevention, all these things so that they really understand the impact of their gift. Little 2025 baby facts. In 2025, over 4,000 babies were nourished. We welcomed 600 new donors and over 400,000 ounces of human milk dispensed. We have been growing quickly. We see about a 20% growth a year, so we're excited to continue to grow and be able to service more families. Bit about milk donors. So who donates milk? Healthy mothers with extra milk. It's a minimum, the first donation is a minimum 100 ounce. That's about one Ziploc baggie of milk. Baby needs to be less than 24 months old and milk expressed less than 8 months ago. So frozen milk, we take it to. Specific things we are looking for are areas of concerns are medications, substance use, recent risks for bloodborne diseases or infections. And so we have sometimes people are a one-time freezer clean out. They're moving. Baby developed a dairy allergy. They have high lipase. The baby won't take it. Some of our donors are just super producers and make massive amounts of milk and, donate throughout their entire lactation journey. About 25-30% of our donors actually received donor milk in the hospital, and knew what it meant to them, and they want to be able to what we call pump it forward. So, they learned about it. I often say that I think 100% of families that have an excess supply of milk and knew if they could donate it and potentially save a baby's life, they would do it. So it's really awareness and getting that message out there. And then a small portion of our donors, so this makes up about 5% of our milk donors, and this is Stephanie's baby, is the Cherry Blossom program. So these are bereaved donors. When we first opened the milk bank, so about 5% of milk donors throughout the US are bereaved, and we knew we wanted to have a program that supported this. And the Cherry Blossom name is because the cherry blossom is the most beautiful blossom with the shortest lifespan. And when we started, we were really kind of thinking NICUs, but quickly realized, within the NICU, the family has a social worker and a lactation consultant and a pump and a pediatrician and a neo and a nurse and are very well supported. And it's actually our fetal demise population that there's a huge gap in care. So anytime after 16 weeks gestation, your body will make milk. And so these families, let's say, have a 20-week demise, go into the hospital, deliver the baby, are discharged quickly at like 12 hours, and no one's talked to them. They don't have a pump. They don't have a baby. They don't have a lactation consultant. They don't have a pediatrician, and their milk comes in. And so our goal is to fill that gap really with education and resources so that these families have a choice of what to do when that happens. We have cherry blossom bags in about almost 30 hospitals and clinics throughout California. They don't have to be associated with the milk bank or UC. We can overnight these bags to anybody. They're at no cost. They have a double electric pump or a hand pump donated to us from Limerick. They have pumping supplies, resources, information on suppression, pump for comfort, and donation if they're interested. There's no obligation. They don't have to return the pump. It's purely, so there can be a touch base in the hospital, hand them the bag. They're not going to want to have a conversation, but instead, hey, when your milk comes in, here are the resources. So again, that they didn't get a choice in this terrible thing that happened to them. They should have a choice of what to do with their body though after, and being aware that pumping and donation potentially is an option. And it's not for everybody, but for the families that do it, they will say that it saved their lives. It gave them purpose. They, a lot of times they'll say that we're the first person who asked them what their baby's name was. We're the first person who called them a mom. And really just honoring them and their family and their grief journey. And our donor coordinators do an amazing job of really just shepherding the families through the process. There's no minimum donation amount. We bend over backwards if they want to donate one tiny little bag. There's also, we have the ceramic blossoms. I don't know if you can see in that picture that are up on the tree with the baby's names. And again, they don't have to donate to do it. It could be a rainbow baby. It could be somebody who just comes through a tour and this speaks to them and they want their baby up there. So, there's a lot of complex grief associated with fetal loss. And one of the biggest things is because people don't talk about it. So, Stephanie's done a lot of research on this, and one of the things we really realize is these families want to talk about their baby. They want to honor their baby, and so, we say the worst thing you can possibly do is not say anything. Kind of a very small piece of what we do, but a really important thing with a big impact. A little bit about the donor screening process. Donating milk is free of charge. And again, I kind of talked about that. We really want to make this a meaningful educational experience. And although the donors, they have to meet these strict safety and screening requirements, we also want to, we streamline the process to make it as accessible as possible. And, trying to reduce barriers while maintaining these high standards, really helping and more families participate in providing this life-saving resource. Again, this idea of milk medicine and this community bond. Kind of 5 steps, easy steps to donating milk. There's register online. I think I go over it in a minute about we now are using MyChart and Epic. Complete some brief questionnaires. There's a short phone interview with our donor coordinators, some consents, and forms. And then if they're local, they could have their blood test done at the blood bank and drop off their milk. If they're out of area, we send them a Quest lab requisition, and then shipping boxes, materials, and prepaid FedEx ship labels. So again, how do we make this as easy as possible? And then just this idea of the gift of milk giving, and it creates this community, and it's this really positive impact of helping others. We've had a couple moms with history of postpartum depression that again said that this helped them feel connected. It helped them feel like they were doing something. Our donor coordinators again do an amazing job with educating about neck prevention, and milk is more than nutrition, it's medicine, those type of things. We do a letter of commendation for military service members to help with promotion. And then we always like to say that the 1 bag of pump milk, like this little one is holding, can actually feed a micropreemie for a full day. So that impact of all those little bags of milk of all those babies that they are feeding. So again, really making sure that our donors understand the impact. There is a beautiful, this came out, I think, a couple years ago. It's called Milky Bonds by Ayelet Oreg. And it's just this whole idea of creating this community that milk giving is not just this altruistic gift, that it's actually, mamas helping mamas and babies helping babies, and really this familial idea. And this ties in very easily with the whole idea of milk medicine. And this is just a quote from the article. It says, individual acts of volunteering evolve into expressions of solidarity within a maternal community, cultivating belongingness among donors who share a common identity and purpose. And it gets tying into that milk medicine, tying into that pump it forward mentality, those donors that receive donor milk, and even our cherry blossom families, that they feel like they are part of something, and that it's bigger than just them. And then, oh yes, so just bringing up donor milk, it's more important than ever. So we, being part of the UC system, has a ton of benefits, and one of them is that we were actually able to work with the UC Office of the President to pass California legislation AB 3059. And so this went into effect of January of 2025. And it defines donor milk as an essential health benefit under commercial insurance plans, meaning that it has to be for medical necessity. Donor milk is covered. This more impacts our outpatient medical necessity families. The other thing it did was eliminate the tissue bank license for acute care hospitals. So before that, every hospital that had donor milk had to have a separate tissue bank license. Currently, they're about $1,200 a year, and kind of a cumbersome application process that didn't make sense for a hospital having to have. Of course, the milk bank has a tissue bank license because we're handling raw milk. Milk depots have to have a tissue bank license because they're handling raw milk. But on the hospital that already is handling breast milk, they don't need this additional tissue bank license, which ended up being a barrier for some of the smaller rural hospitals. And just again, talking about how do we increase access So in December, the milk bank moved to Epic for donor management. So it's a MyChart type of setup. The donors are very happy with it because they're used to MyChart going on there. They feel very secure. The questionnaires, the consents, everything's on there. They go online, they fill in their information, and we kind of set them up through that. So that's been a great. We're also able to, so prior our time to approval, so time to sign up to time to approve was close to a couple years. It was in 30 days, then we got it down to 20 plus days. But since we're, moved to Epic, we're now down at about a week that we're able to get somebody through the entire process. So again, how do we make this as easy as possible for these families donating? We are also working with our contracting department because another gap is um, medical babies with a medical necessity. So again, along those lines of AB 3059 that took effect in 2025, there's, the insurance companies are still kind of lagging along. So we are in the process of the milk bank being added to these bigger insurance company contracts, Aetna, Blue Shield, Cigna, and so that families that need it, it will streamline the process, and we will be able to bill directly to the insurance company. So then the family will take a lot of that stress over those families who are already dealing with a lot of different things. And then I just want to kind of take a minute to talk about milk depots. And I know I mentioned that earlier, but milk depots, it's that location where they could drop off their milk. And it 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 number one, it increases access because it's convenient drop off. Um, a lot of donors, the being able to ship the milk is very safe. It's easy. The milk gets to us, it overnights to us, so it gets to us in beautiful condition. But a lot of families want to hand somebody their milk. They have put so much time and effort and love into this milk that they kind of want that connection of being able to hand it over. We've also found that the presence of depot in hospital and community settings really increases the awareness of donor milk and encourage families to learn about it and human milk and really understand the importance of it. Um, and then expanding depot networks throughout healthcare organizations and communications can really reduce barriers to participation and improve access of donor milk to vulnerable infants. So that's one of kind of our little projects that we're working on. We do an annual grant application to help uh, locations that are interested in opening a depot. We cover the cost of the tissue bank license and the freezer. Um, and so I kind of mentioned a little bit briefly about the San Diego Blood Bank. We have drop-off locations in South Bay, El Cajon, Vista, Escondido, Irvine, Claremont Mesa. Coming soon, UC Davis is going to have a depot opening by the end of the year. Um, uh, Santa Maria, Santa Monica, and then we also have locations at UC Riverside and Ventura. So, for example, Ventura was one of our first depots, and by opening a depot, pre-depot and post-depot, they've actually increased donations in their area by 200%. So again, it's this awareness of what's there, and really just helping to spread that message of the importance of human milk. I just want to touch briefly on our 100% NICU, 100% California project. And so really with the idea of equitable donor milk access, and it shouldn't matter where you're born. When we opened in 2020, about 66% of California NICUs had donor milk. By 2023, that number was closer to 88%, as more and more evidence came out about neck prevention and the importance of donor milk. But that 12% of NICUs, California NICUs that didn't have a donor milk program were mainly small rural safety net hospitals. So really looking at what are some of the barriers that we can eliminate. So with the passage of AB 3059, we created a hospital implementation toolkit, did a ton of outreaching. The project incorporated a lot of different members and a lot of different boots on the ground people really to make this happen. And so we're excited to say at the beginning of this year, 100% of California NICUs either have donor milk or are in the process of starting a donor milk program. So I will be very excited, hopefully, to say by the beginning of next year that that is 100%, that truly doesn't matter where they're born, they will have access to donor milk. And this includes all level 2, 3, and 4 NICUs. And then this slide is just really to kind of touch base on normalizing donor milk use and milk donation, and really normalizing that this is part of that potentially this is part of the lactation journey, because not just educating about milk donation, but educating about the safety of donor milk. So if you have a premature baby, if you're baby and you don't have an adequate supply, that donor milk from a Habana milk bank is safe and screened and it's tested, and that it's important um, that your baby has access to it. And then on the flip side, that if you have extra, that you can donate, and all of this can be part of this community support of helping these babies, really have the best start in life and be able to thrive. And just real quick, I want to touch about it's related but unrelated, but really clear messaging regarding the risks of informal milk donation. A lot of people do informal milk sharing because, they think that formal milk donation is too hard. There's too many steps. Again, what are we doing to help reduce those barriers and make it easier? And, the people who are donating their milk, even when they're selling it on Facebook or whatever, it's, they want to help other families, and none of this is malicious. But there was a recent case up in Santa Clarita. Santa Clara Public Health Department was notified of a mother. So she was breastfeeding her current baby. I believe her baby was 2 years old. And she was donating her milk through Facebook or through some online group. And she became pregnant and went in for her prenatal care and was positive for HIV. And so she was currently breastfeeding. I was a 20-month old, and then realized she was positive for HIV. They were able to identify 5 families that her milk went out to. One of them had never used the donor milk, was still frozen in their freezer, so they were able to get that back, and it did have a positive viral load, a detectable viral load. The 4 babies that did receive her breast milk tested negative. And so again, these families are trying to help, but there's a lot of safety concerns and risks. And I understand too that there's a lot of cost in buying donor milk. So again, how do we decrease these barriers and make this accessible for everybody in a safe manner? And then kind of just tying it back to an Indigenous perspective, human milk is often recognized as medicine and not nutrition. And donor milk really extends this understanding by allowing communities to share that medicine with other babies who need it most. And, milk donation is not just an act of generosity, it's an act of reciprocity, where families who have an abundance are able to contribute to the well-being of other families and babies. And really just it reflects this collective responsibility to nourish and protect our next generation. And, through donor milk, communities can really come together and ensure that vulnerable infants have access, to the healing and protective benefits of human milk. At the same time, while honoring interconnected values of reciprocity, relationship, and shared care. How can we make this happen where everybody has access? Um, and just a real quote, this is from Joshua Lyons Echo Hawk. She is an Indigenous birth worker and advocate and founder of the Indigenous Milk Medicine Week. And their work centers on Indigenous knowledge, birth sovereignty, lactation equity, and the recognition of human milk as a sacred form of medicine that supports the health and well-being of infants, families, and communities. And I love this quote from her. Milk medicine is more than nourishment. It is a ceremony. It connects us to our ancestors, to our babies, to our land, and to our futures. And just I offer these questions up to encourage just kind of thoughtful reflection on how can we strengthen equity, respect, community benefit within our own work. Not just taking from the community, but truly giving back. So how can donor milk programs embody reciprocity, ensure it's like giving and receiving milk strengthen relationships and community rather than functioning solely as a transaction? Whose voices and lived experiences are underrepresented in leadership and decision making within milk medicine and lactation spaces? And how can we ensure that the benefits of milk donation research and milk banking are shared with the communities that we serve? Our mission is not only to nourish these babies, but truly, impact the community as a whole. And I just want to mention real quick, the Human Milk Institute has a virtual preemie breastfeeding support group, offers guidance and peer support and evidence education for families of premature babies. Really just kind of navigating feeding challenges. Clinicians are welcome, family members, babies that are in the NICU, graduates with, or really any babies with feeding issues. And it's the last Friday of the month, virtual Zoom. We also have swag at no cost. If that QR code will get you to a form, you can order posters or postcards or storage magnets, to help again with awareness and getting that information out there. Kind of with our Pump It Forward tagline, really kind of reiterating that idea of community bonding. And then I always like to throw it out there. Anytime you are in the San Diego area, please reach out. We love to give tours. I can talk about this, show you pictures, but it's amazing if you're able to see it in person and see the whole process and really be able to speak to all those safety steps that we do to ensure the quality and safety of the milk. If you are interested in receiving continuing education credits, please scan this QR code. And for one CEU, it's going to bring you to a survey where you put in your information, and then it should auto-generate a CEU certification to be emailed to you. So I will leave this up for a minute. And then there's also a link in the chat and an email if there's questions. And I just want to do a quick call out to the education department at UC San Diego Health for making this available to us. And then finally, just a quick thank you. And I want to be able to open this up for questions.
Our Thank you, Allison. Thank you so much. There's a couple of questions in the Q&A.
Sure.
The first one I believe you answered in terms of the Assembly bill. So I'm just going to mark that as answered live.
So wait, let me just make sure. Okay, perfect. Don't know. Oh, Jamie. So I don't know if you guys can see Jamie's donor thank you suggestion. Suggest a thank you letter from recipient families. So it looks like Jamie was able to receive donor milk, and she would have loved to send a letter. It's kind of ironic that you said this. So we actually had a meeting this morning about the same topic. We do have on one of our websites that recipients can put in a little note, but we are working on like a little, almost like a postcard, so that when a family gets donor milk, they get this little postcard, that says, with a QR code that does say, hey, if you are interested in sending a letter of thank you, please enter it here, because to our donors that we've been able to, obviously we do it anonymously, we don't send names or anything, but we're able to send that thank you card to the actual donor, and they're so grateful to be able to hear how it impacted other families. One of them actually told us like her husband was not supportive of the donation process, and he really didn't want her to do it, and then they got this thank you card from somebody who was able to receive the milk, and he was like, babe, you got to donate more milk. Like really that impacts. So I love that. I love that. We were just talking about that. Amber, why the 24-month cutoff for donation? That is a very good question. So it used to actually be 12 months, with, with this idea that what components are in breast milk? Is it safe to take breast milk from an 18-month-old baby, give it to a 23-week preemie? We did a lot of research comparing first year and second year milk, and found that the actually calories and protein and HMOs are higher in the second year milk, most likely due to rate of expression, how often it's being expressed. There's not a ton of people donating second year milk, and we are open to the idea if there is somebody who was after that 24-month, could we do some testing on it? But there hasn't been a big population. And then any restrictions on how breast milk is collected or stored by a donor. We recommend we give them information about how to clean their pump parts, but since we are testing and pasteurizing the milk, we don't have any restrictions. So we do have some families that do the fridge hack, putting their pump parts in the fridge, or doing 24-hour pooled, and we're able to take all of those. We're actually looking at doing a research study on the fridge hack, and trying, because there isn't a lot of evidence saying is it safe or is it dangerous. But because we test and pasteurize, we're able to take all those milk. Yes. So does UC Milk Bank partner with Mother's Milk Bank? Yes. We are both Habana Milk Banks. We have the same vision and mission. I meet monthly with their executive director, and we are hoping to partner more and more because, the goal is the same, to have these babies be fed. So any way we can build those partnerships, we are happy to do. We actually did a dual presentation at the last California Breastfeeding Coalition. Please share links. What do you think about groups like Human Milk for Human Babies? So this is an excellent question. So this is kind of about that informal milk sharing. So I kind of look at it as like with co-sleeping. We know that a baby sleeping on their back in their own bed close to the parent is the safest way, but people do co-sleep. And so if they're choosing to co-sleep, how do we educate them to do that as safe as possible? So I kind of think about informal milk sharing in the same way. And so there are groups, that do have guidelines. Some have some limited testing. So it's really about education and risk mitigation and making sure people understand the decisions that they're making. So I know it's a hard call, but that last HIV scare is pretty terrifying. So Sarah asks, does all the milk get mixed into a large vat, or do individual donations go to children? Do you know who your milk is going to? So yes, we pool those 5 to 9 donors into a big pot. We don't do single pool because we want to be able to make sure there's adequate HMOs, so specifically that DLSNT. And we do know that 1 in 5 women have lower levels of DLSNT, so we want to be able to pool them together. And the donor doesn't know, we aren't able, because of HIPAA, they won't know where their milk is going to, but we have talked at some point to be able to do like even location though, like, being able to link the donor when their processed milk goes to, let's say, hey, it's going up to UCSF. I think that donors would love to know that information. And then they were asking about the slides. Yes, all of the slides are going to be shared. So you'll be able to see all those, that specific slide in there. And then my granddaughter recently benefited from human milk donations in the NICU. We were surprised at the pediatrician's discouragement and push for them to accept formula over human milk. Do you have any data on the acceptability of human milk use among NICU staff? So there's a lot of data out there. MPINC has a survey of donor milk use in the hospital. You know, there's some true believers and there's some who don't. So, but I don't know of any studies of like staff acceptance of donor milk. It just, you do have some units that are much more human milk friendly, period. And those are the same units that have lactation consultants, pumps available for every family, donor milk available to everybody. And then you have other hospitals that just kind of have higher restrictions, unfortunately. But we'll get there. Education and getting the word out there. Mandy asks, curious to hear whether it's in the Radiolab podcast called The Elixir of Life. It discussed how Dr. Ron Scotland, a neonatologist, was able to treat premature babies with B-implant to prevent NEC. He was shut down. Oh, cool. I'll listen to it. I haven't listened to it, but that I love hearing about new podcasts. Yeah, the whole and also the probiotic use. You know, if anybody's interested, if you go to the NEC Society website, they have a lot of information on probiotic use to prevent NEC. But I know the FDA has not been very supportive of that. What does the UC Health Milk Bank do to promote gender inclusivity in milk banking? I noticed early on the presentation said breast and chest, but later slides referred pretty exclusively to mother's own milk. So yes, great question. We use the term mother's own milk because that is what the American Academy of Pediatrics and the American Breastfeeding Academy refer it to. But you know, we have inclusivity in everything that we do, and that you know, when we call it breastfeeding or when we call it mother's milk, that is inclusive of everybody. But great question. Sarah, I think this is the last question. I asked because in Islam, if your milk feeds 5 feeds, then they are your child. So there are in the Muslim faith that there are some concerns with. There are some barriers to donor milk use because they're concerned that if their baby takes milk from a donor, that potentially if they couldn't marry somebody else, and there's all these rules. But there's been a couple. Oh, I'm going to mispronounce. I think it's a fatwa, F-A-T-W-A, that have come out. I have 2 milk sons that has said that donor milk does not fall into these criteria. And that, again, because we wouldn't want a tiny little micro preemie not to be able to benefit from donor milk if they need it. So there is a lot of education, especially in communities that have high Muslim concentrations. Oh, thank you, Jessica. Yeah, Mandy, I'll definitely listen to that podcast and check out Next Society because they have a lot of materials on probiotic use. Well, I just want to say, you know, thank you for everybody for joining us. I will put my email in the chat. Please reach out. I'm always happy with questions, suggestions, anything we can do better or partner in any way. You know, please just let us know. And I just want a big shout out to UCSF for kind of spearheading this and hosting this and, you know, partnering together.
Great. Thank you so much, Alice. I appreciate it. And I'm happy to have everybody on the webinar and engaged in asking questions. This was really terrific. So again, thank you. And thank you, Dorothy, for helping us behind the scenes. And just want to put a shout out that in November, we will have a donor milk collection on November 7th. So you'll be getting some more information about that. Again, thanks everyone, and I hope you have a great afternoon.